Green light given, thank you. Good evening. Good evening. Bienvenue. Hello. I hope you're all doing very well. Thank you so much for joining us today amidst a heavy conference schedule. It's a beautiful audience, thank you. We recognize days are long, so we will aim to keep things concise so we can move into social time. Baraka Impact Finance is a fortnight away from greeting users onto Baraka Analytics, a coordinated effort at accelerating capital and health innovation for emerging and underserved markets, mutualizing best practices in impact investment, and revealing untapped opportunity. The World Health Summit in Berlin and this gathering represent a formidable occasion to reveal our platform and host this amazing panel of speakers. The Baraka team has worked hard, carefully, and enthusiastically to get this evidence-rich and user-friendly platform where it is today. Our team will gladly answer all your questions during the course of the evening. Our warmest thanks go to the Johnson & Johnson Foundation, J&J Impact Ventures Global Director Dana Deerdorf, Caitlin Bristol, Sarah Mullane, here present, Fenton, and their entire teams for their continued support, allowing us to reach this milestone. We specifically wish to thank those close to 50 health innovators who have already agreed to join Baraka Analytics, as well as our technology partners and data providers Artha Networks, Arcanite Solutions, the UNDP, IHME, the Heidelberg Institute for Global Health, and the Copenhagen Institute for Future Studies, represented by Mr. Bogi Eliasson, present here, among several others. We hope those attending our live stream will have a pleasant experience. I'm adding a little bit of pressure on the tech team, but which has been great, thank you, and that they may catch a glimpse of this beautiful space kindly provided by the Sheraton Esplanade. We know many friends are attending or presenting at other events globally, and they're with us in spirit today. Without any further delay, please let us dive in, share, and enjoy. I will pass the mic to our stellar Managing Director, James Baer, who will introduce our company. Thank you.
Thanks, Talal. I didn't know what Talal was going to say, and I feel like he already said it, so I can just kind of stop. But that's great, Talal. Thank you. I'm going to spend about 5 minutes telling you about Baraka Impact Finance, just so you understand the context in which we are presenting Baraka Analytics. And Baraka means blessing in Swahili, Hebrew, and Arabic. And it really is that spirit that I know every single one of our team members and all of those that we interact with feel that we are working within. We're delighted to be doing this work. We believe in the outcomes of social and health equity, and we're inspired by the people we get to work with every day. Next slide. So I always talk about 3 assets that represent Baraka, and that's our incredible pipeline of 280 to 300. It kind of vacillates, 50 of whom will be on the pilot that you'll hear about today, Baraka Analytics. Those innovators are amazing and inspiring. We have several of them in the room here today with us. And if I had my druthers, I would just spend every day talking to them about their challenges, their opportunities, and where they're headed with their businesses, because it's truly, truly inspiring. The investor network is broad, and it represents everything from development finance institutions to corporate foundations to impact venture funds to high net worth individuals. So what we have concluded in our last 5 years of operation and putting this into place is that it takes that kind of village of different types of financiers with different objectives and with different vehicles to actually make these things happen for our innovators in emerging markets. So we work long and hard to inspire and engage and meet the expectations of that investor network. Baraka Analytics is what you're going to hear about today. I won't spend a long time, but I will tell you this. It was the original vision of the co-founders at Baraka that we should have such an online presence that brought deep data analytics and analysis to the opportunities that are in emerging markets. And again, you'll hear more about that today. We are always at Baraka driving for the twin goals of market rate returns and measurable social impact. We don't leave the two separate from one another. We're always looking together, and I'll tell you a little bit more about how we do that. So our pipeline, a bit more about them. So we are entirely emerging market focused. About 80% of the companies that we represent are domiciled in emerging markets. Another 20% are domiciled technically in the EU or the US or maybe Japan, but they are all have solutions for underserved markets in low and middle income countries. Commercially scalable and measured social impact, I already mentioned that, and we'll spend more time talking about how we look at both the commercial feasibility and the measurable and monitorable social impact as we go through the presentation. Growth stage. So I sometimes feel kind of bad that we're not working at the pre-seed level or with brand new innovators, and there's a choice around that. We want to mobilize capital. We don't believe we can do that if we stay only at the pre-seed level. We need to go up the food chain a bit in order to excite and incentivize new capital to come to the health innovation table. So that's the companies we're focusing on, and there are just 3 of them represented here today, and that's exactly the position that those companies are in and that all of our companies are in. And then those companies, because they are a little more mature in their development process, are raising between 1 and 20 million, and that can be in grant, debt, and equity capital. I've had my own learning curve. I thought it was like this. You're an innovator, you're brand new, you're pre-seed, you need a grant. And then you mature a little bit, and then it's time for you to have some equity. And then you mature a bit more, and you can actually take on some debt. It's not what's happening. It's not what's happening. What's happening is a combination of all of those vehicles coming together. And my projection, and I think the team would agree on this, is that that type of mixed financing for true health innovation in developing economies is always going to be needed. You're going to need that mixture in order to be successful, in order to truly innovate, in order to reach populations that you haven't reached before. We have companies across this entire health continuum, and I know I'm kind of speaking to the converted. All of you understand this continuum, but to be very clear, we're looking at diagnostic solutions, at treatment solutions, at patient data management solutions throughout the continuum of care. You'll see those 3 lines: primary care, health financing, and workforce capacity, because those are constants across this entire continuum. And we have many ventures that are focused specifically on those constants across the continuum. Once again, we're using a comprehensive and really robust approach to understanding commercial viability. And we'll tell you more about the detail of that, as well as social impact. Perfect, you went on, it's good. Our team, so yeah, the blessing part always comes in when I get on a Zoom call, because we're spread across the world. So when I get on a Zoom call with any of my team, I really recognize the blessing. It's a really smart group of people with a very diverse group of skill sets. We have deep roots in global health, which is my own, and Dr. Batista, who you'll be hearing from shortly, and Rebecca and others. But we also have legal expertise. We also have social impact expertise, and we've got SME financing for emerging markets, and other well-rounded expertise that allows us to make the kind of analyses that we do, and hopefully it's good, including data analytics and including legal structure. I mean, we're really very diverse, and you'll notice we put the locations of our various team members out there, so you get a sense, though we're small, we're spread out globally. Okay, that was it. That was Baraka Impact Finance. And I'm sure it generates more questions, and we'll tell you more about it. But the point tonight is to move on to this panel, and I'm going to ask my colleague, the Senior Associate for Health Impact, to come up, Rebecca Thomas, and introduce our panelists. And our panelists as well. And yeah, so there was a script here. I don't always, please come up, panelists, and have a seat. Oh, I'll do it now.
I always appreciate James for bringing so much energy into the room. I hope you're as excited about this as we are. My name is Rebecca Thomas. I'm a senior consultant for Health Impact at Baraka Impact Finance, and I have the pleasure of introducing our panelists today. So I'll jump right in. First, we have Boye Eliassen. He's the Director of Health at the Copenhagen Institute for Future Studies. He's worked as a consultant over the last 20 years for politicians, the public sector, and private companies. Boye was the initiator of the first genome project to sequence the genomes of the entire population of the Faroe Islands, where he's originally from. As Director of Health at SIFS, Boye and his team apply a holistic vision for rethinking health paradigms that integrate the future of genomics, the use of data, and the integration of digital capabilities. Boye is credited with founding the Nordic Health 2030 initiative and holds a leadership role in the Future Proofing Health Index, among many other global health initiatives. In 2019, he received the HIMSS Future 50 Global Award for his work. Thanks for joining us, Boye. Next, we have the lovely Sarah Mullane. As part of J&J Impact Ventures, Sarah Mullane, Director of Health Technology, is dedicated to tackling global health challenges using a problem-first rather than solutions-first approach. For more than a decade in both research and industry settings, she has combined behavioral science, data science, technology, and user-centered digital ecosystem thinking to explore what works for whom, when, and under what circumstances. Thanks for joining us, Sarah. Next, we have my idol, Carolina Batista. Carolina, she's the head of global health affairs at Baraka Impact Finance. She's a global health leader and infectious disease expert who's been at the forefront of improving the health and access to care for underserved for nearly 20 years. Receiving her medical training in Brazil, she spent her early career providing care to indigenous communities in the Amazon. Carolina went on to spend 15 years with Doctors Without Borders and the Drugs for Neglected Diseases Initiative, most recently serving as an elected member of the International Board at MSF. She has extensive clinical and field experience working in health systems in low-resource settings and has led multiple initiatives focused on innovation and changes to improve care access and equity in those settings. On this side, we have our lovely founders. First, we have Uche Ezerinachi. Ushena is the senior lead for innovations at Zuri Health, an award-winning health tech company with a mission to provide the best universal healthcare experience on demand. Uche is a healthcare professional and a trained pharmacist with an MSc in drug discovery and development from University College London. Her role at Zuri Health allows her to merge her pharmaceutical knowledge, project management skills, and innovative thinking to develop solutions that revolutionize the way that healthcare is delivered, making it more accessible and efficient for all. Beyond her professional pursuits, Ushena is passionate about creating a more holistic approach to well-being throughout the convergence of data, creativity, and healthcare. Welcome, Uche. Next, we have Camila de Pamfilis. Camila is the Chief Data and Patient Experience Officer at Mammotest, a company that we've worked very closely with at Baraka. And they're a social impact company with the mission of democratizing access to high-quality diagnosis and treatment to reduce breast cancer mortality rates, operating in both Argentina and Mexico, and hopefully soon Colombia. Camila trained in industrial design at the University of Buenos Aires. She held various positions in the areas of science and technology, and in Buenos Aires, developing tools for the digitalization of public operations. Initially hired as the Director of Operations at Mammotest, in that role, Camila was responsible for assembling the management team, led development of new business units inside and outside the country, and led innovation strategy for database patient navigation and leading the development of the company's newest initiative, Boulder, a tech platform that connects all actors in the health ecosystem, combining AI, structured data, and human value to provide the best and most efficient experience to patients in the world. And she's a wonderful speaker. And last but not least, we have Vivian Nwaka. Vivian is the founder and CEO of MedSaf, a pharmaceutical technology platform that improves access, affordability, and quality of medications in emerging markets. A company that we don't have on our pipeline yet at Baraka, but we would like to have very soon. With over 20 years of experience in the healthcare, pharmaceutical, finance, and energy sectors, she's a serial entrepreneur and strategist who's created and innovated around execution and impact. Vivian has received multiple rewards and recognition from Forbes, the British royal family, Women in Africa, Seed Stars, and many more as a high-impact entrepreneur. She's also been featured in CNN, Forbes, the Financial Times, and AFP. She holds an MBA from Georgia State University, a Master in Administration from Sorbonne University, and a certificate in International Business from COPEAD. She's fluent in French and Portuguese and has a passion for solving global challenges. Welcome, Vivian.
Thank you. So we have structured this panel around what I can pull up in my Kindle. So give me 1 second here and I'll do this correctly. We structured this panel as a rapid fire kind of format. We thought that it would be, certainly we have the diversity of opinion here, that after you hear from these 6 speakers on any of the topics at hand, we think it's going to produce a really interesting and textured set of responses. We're focused on 3 things. How can health data be used to scale up access and equity for the underserved? How can market data, as opposed to health data, how can market data be used to frame the value proposition and attract investment for global health solutions? And then thirdly, how can data be leveraged as a business asset and a driver of innovation for the future of health? So those are our 3 general areas that we're focused on. We have thought leaders, and I'm sure they all cringe a little bit inside when I say the word thought leaders, but they are. And we have founders who are really frontline in the work that they do. And so I think that contrast should bring some really interesting perspectives. We've asked each of them to keep their responses to just 90 seconds, right? A minute and a half. So it's going to be quick. And we'll start with the company founders. Uche, you're next to me, so I'm going to start with you. I know, right? I could. And the first question for our founders, we'll do 1, 2, 3, and then we'll go 1, 2, 3 to the thought leaders with slightly different versions of the questions. Data is a critical component of your business model and your impact measurement. Can you share some examples of how you have used health data to improve access, affordability, quality, and equity within your target population?
All right, then. Thank you so much. Well, first of all, I'm not a founder. I'm just sitting in, so I'm just...
You're right there.
I'm right
You're on
there.
the front line.
I'm just close to... Okay, thank you for the question, James. At Zuri Health right now, we are a health tech... I don't know if we all know about Zuri Health, but we're a health tech company, and we try to provide accessible and affordable healthcare solutions to sub-Saharan Africa. So right now, in your question, so recently we have done a couple of health camps in Kenya, Nairobi itself. We are in partnership with the M-Pesa Foundation in Kenya. We're trying to reach the 47 counties and actually provide free medical solutions to this. So from there, the data that we have gathered, it actually influences what we do with it. We know, okay, where do we have the highest burden of NCDs? Where do we have the burden of family planning, contraceptives? What do we need to do with these areas? So we have done have about 7 health camps we've actually done right now. And from there, the data we've gotten is amazing. We know in the different aspects of Kenya where we have the population of women that need this. We've also found out that in some counties, there's the issue of fistula screening. So that also is going to be great in influencing how we actually target these people, what kind of interventions we provide to them initially. So I think that's like short answer. Under 90 seconds.
It's excellent. Why don't you hand the microphone to Camilla?
Thank you very much. And thank you very much for the invitation. I'm very excited on participating on this launching event of our great partners. According to your question, at Mamotas, we are a completely data-driven company. So I'd rather categorize the way we use data on 3 layers. First is like for immediate efficiency. We provide data to doctors, to patients, so as to guarantee the patient's flow through their patient journey. This has to do with triggering flows according to screening results, or depending on how many days have passed from their screening or their diagnosis, and they have to reach already treatment. Then we have a layer of reporting or evidence generation, which we share with our investors. We somehow organize data and statistics, anonymized obviously, for governments, insurance companies, pharma companies, or tech industries. And on the third layer, we use data for tech development and AI specifically. We understand that data by itself, it's not very useful, but it's the way we analyze and how we implement it that we find our value proposition. So that would be layers of data.
Perfect, Camila. I know you're doing amazing work. We've witnessed it. Vivian, MedSaf, Nigeria.
Yeah, definitely. I think just to thank you all for your contributions, and thank you for letting me be here. This is really, really cool. So thank you, everyone. But what I would kind of approach this question is just maybe painting the picture of why data is so important and how hard it is, and what maybe investment needs to go into infrastructure to be able to actually extract relevant information. So my company is called MedSaf. We're a pharmaceutical company operating in Nigeria. And when I first started the company, everything was paper. So, just to do maybe 3 or 4 orders of a hospital, we would have a stack of receipts and invoices this high, from at least 40 different suppliers, maybe, hundreds of different medications, and everything was written, handwritten. And then that's what the suppliers were doing, and even some of the manufacturers. And on the other side, the hospitals, everything is on paper. So all of their records are on paper. And on top of that, they were not using technology or computers in any way, shape, or form. So we were having to teach them how to use Excel, and then we stepped them up to being able to use a solution that we developed. So from the very beginning, I knew that we had to put these people actually on a system and have them actually understand that. But once we were able to get people to actually adopt technology in their business, place your order online, as simple as that sounds, like that was actually revolutionary, because it allowed us to put in strategies like preemptive demand. Because if you think about it, we are creating a one-stop shop for hospitals, pharmacies, and healthcare providers to purchase 100% of what they need. And so an average hospital might have thousands of products that they're using on a monthly basis that come from many different suppliers. So think about the mess that I'm talking about here. It's like it is huge mess, right? And so we've got to then purchase these medications from multiple layers of suppliers, some even international. And so now you can see that the problem gets even more complex. And so by being able to, put people on, a system and actually, collect this information, now you can start to get in front, of these really hard infrastructure problems in a country like Nigeria. And this can actually save lives. And I have examples in oncology medication, for example, these really expensive medications that you can't invest, as a startup. You're not going to invest hundreds of thousands of dollars, in holding a medication if you don't know if you're going to be able to actually get it to the patient. And so being able to kind of develop around both sides of this pharmaceutical supply chain can now actually save lives, because now you can actually get as close to that demand as possible, save, be efficient with your funding, and be able to actually get medications to people just in time. And so there's a lot more I could talk about on the topic, but it's definitely a huge benefit for companies like mine.
Thank you, all of you. And it's so, again, moving to me to hear this frontline management of, resources that can really change lives and change access, and the day-to-day of what you're doing is admirable, and thanks for taking it on. So we're going to take the same health data question and kind of turn it over to our thought leaders. So we recognize that data is a powerful tool for informing policy, practice, and research in global health. Can you share some examples of how health data has been used effectively to enable expansion or enhancement of services for the underserved in different contexts, different markets? Boy.
I start, yes. Thank you so much, and thank you for inviting me here, and first thank you to the first three ladies. That was really inspiring. So I'll take a couple of examples that we work with, but first I will say that from the Institute side, we have two taglines that we use. So how do you move things from feel good to do good? And how do you make sure you make the right things right? Sounds very simple? It's not. So when we started to work in Latin America in the start of COVID, the general understanding was that you should just raise the taxes in the countries and then you would solve everything. Knowing my wife is from Peru, knowing that 80% of the workforce is informal, you go like, did they ever go there? So we did a deep mapping of Latin America on different aspects, and it actually shows that most countries have problem spending their budget because of different locks in the system. So we focused on saying, look, let's spend the money we have before we ask for new money. That was one part of using data in that way. We also did a quite comprehensive survey among health professionals in Colombia, because we were thinking, what kind of very advanced capacity building do they need to work with digital health systems? But the request was actually on basic knowledge on Excel and Word and Office, which surprised everybody, right? And in Chile, we have also worked with a group with different Delphi study methods to build a manifesto for both reducing the waiting list and for data interoperability, which the government is now using. And one of my favorite example is in Hungary, when we did the Future Proofing Health Index. I went there to present it. Or before I presented, they were all complaining. It was a closed meeting because the results were very bad. And they were all complaining about how they didn't have any materials, how they did not have anything in the health systems, until I showed them they actually were quite good on equipment, but very, very bad on using data. And that changed the discourse on how they worked forward. And the last thing I would say that health is about building sustainability in the society. So without data and that, we don't go forward.
Thanks, Boy. Sarah.
Yep. I can't help but feel a stopwatch go for the 90 seconds when you pass along, but
You're up for it.
I'm up. So thank you for listening as well and for inviting. Speaking on behalf of the J&J Impact Ventures team, we are straddling that fine line between profitability and purpose, and that's really challenging for entrepreneurs to serve in that space. And so we really do work with our entrepreneurs to help them do that. We recognize that health data and proving out that impact is not easy. And so with our impact framework, we apply 3 different lenses. We have scale, we have access, and we have depth. And it's the depth that is the so what, and that is so contingent on that health data or proxies for health data. Trying to create a roadmap or plan to get you to the access of that patient health data, that can still get you a long way in the early phases of investment, so don't underestimate that. And I think what we also try to do is, and the power of those 3 dimensions, is that viewing them together allows us over time to see where are the trade-offs as a business model evolves. What do we give up for scale or access? What is the impact, therefore, on depth? And then just finally to tie that up as we think about scale, access, and depth. With some of our portfolio companies, that is about how many patients are reached or health workers supported. That is different to access. So of that scale and population, how many of those can be quantified or defined as being marginalized due to race, ethnicity, geography, income,
That's a different metric. And then finally, depth. Are we really moving the needle on health outcomes for that underserved population? As I said, we work with our impact entrepreneurs to help them do that, and we don't expect you to have it all baked and solved for when we partner with you.
Thank you. Carolina.
Yes, thank you everyone for being here. It's a very special evening for us to unveil the Baraka Analytics tool that we've been working with all our hearts and brains to build. So we're very happy to have you here to witness that with us. Well, the question around data as an enabler for health, I think it just speaks very close to me. As a physician, I've always really believed in health as a fuel for any health intervention, for anything that we do in health. It's like we have the fuel in the car and the car can run. And I think not only for health interventions, but also for shaping policy and creating evidence. And I think this is specifically true when we think of underserved populations and in contexts where there is so much inequalities. And I think with COVID, we've seen how dramatic inequalities were, you know, and I've seen, and it's not only in countries like my own, Brazil, or in countries in Africa and Latin America, but even in countries like, you know, UK or US. I read recently that they did a study that in the UK, if you go with the subway and every stop you go towards the east, you lose a year in life expectancy, which demonstrates the significant disparity that there is in that country. So of course, in my own country, Brazil, if you have, I don't know, Copacabana, if you go in different zip codes in the region, you will also have huge disparities in terms of health indicators, et cetera. So I think I'm very inspired by the work that companies like the ones we have here tonight, but the ones that we work in a day in, day out at Baraka are doing, because these are companies that really understand their context, and they know the data. And they know the data, as I always say, they look under the hood. They look under, you know, the general national data, national statistics, and they know where the pockets and the blind spots of data and the pockets of underserved communities are, and they're designing and delivering solutions for that. So as I usually say, I love to work with these guys because they're the ones, like, they're stubborn. They just, you know, you guys inspire me in a way because you just don't accept that healthcare in your context have to be bad, and you're developing solutions for that. So, and the core of what you do is understanding data from a supply, not from a supply perspective, but from a demand. And we know that people are demanding better and better healthcare, and you're delivering that. So I think, yes, the data is the fuel, and I'm glad we're working to dig deep into data and supporting to build better data for health.
I'm so glad I work with her. I really think it. We're going to switch to market data. I'm going to tell you a 30-second story about a woman that I saw at the Global Impact Investment Network conference 2 weeks ago in Copenhagen. Her name is Bridget Beal, and she's the head of climate risk strategy for KPMG. And if you don't know her, find her, follow her. She talks about the risk evaluation that we're making when we try to solve for the world's biggest challenges. And she says we're making it wrong. We are using the wrong lens to understand risk, and a lot of that is based on market data and our perception around market data, and not correctly understanding market data, and then what the cost of inaction is, the future cost. So market data is real important, I believe. Having worked in the developing world for most of my own career, it still shocks me how few global investors are ready to take the chances and experiment with investments in emerging markets. So market data. And I'm not going to pick on you again, Uche. I'm just going to move around. I'm going to go over to Vivian. Market data is essential for understanding the needs, preferences, and health-seeking behaviors of your potential users, as well as the opportunities and risks in your operating environment. Can you share some examples of how you have used market data to inform your business planning and fundraising efforts?
Hello? Okay. It's an interesting question because where I come from or where I was born and raised in the U.S., it's you can go online and you can find some studies and download them and just kind of put together your thought process on what exactly your market size is, and it's pretty easy. But when I started MedZaf, there was nothing available. And the information that was available, I knew that it was wrong because I personally had gone and canvassed hospitals and knocked on doors and counted them myself with my team when we first started or before we started. And I knew that the numbers that the government had on display were not right. And what you realize in markets that we serve, a lot of the markets that we serve, that information is gold. The data, that information is actually a currency and extremely expensive. I remember I had started doing interviews back then, and I had kind of put an estimate of what I thought market size would be, and then I remember just seeing people using my interview and like actually quoting it. And I remember seeing a government official quote it and I was like, whoa, this is crazy, right? But it's changed now, right? There's much more information out there, but I think it is hard. I think that there's definitely needs to be more support for startups because obviously, I want to be able to raise enough funds to be able to kind of fuel my company and get it to that next level. But I have to be able to show a bank or show, a venture capital that, show a VC that we can actually back that up with concrete numbers. And sometimes it's not readily available. So as you kind of grow your company, you're realizing that you yourself and your activities are, that data bank. And I hope that, there can be more sharing and, support of really opening up the books per se, and the truth about, what's actually really happening on the ground, so people can really get that that true sense of exactly what that market size is, or exactly, what that metric is, so that people can actually start to invest a lot, much more efficiently than they are doing right now. So I think it's a hard one, right? But companies like yours can, help, gather that information from maybe the different startups and players, and then help to kind of, democratize that information, because in some of our countries it's very hard to really double down or pinpoint the exact information. I hope that's helpful.
It was really, I didn't prompt you to say that, but thank you for saying it. Camilla.
Okay, so I'd like to agree with Vivian. I think that the problem with data and the risk of using data, available data, it's how representative it is. Today we are looking and making models around data that's not really representative of the underserved populations or the areas where we are looking forward to impact. Obviously, when you're thinking of a geographic expansion or something, you need to model somehow your solution around whatever you have. But I think that it is essential to somehow question that data when you are on the field, and not think that your solution is going to be replicable anywhere around that data, because it won't. And yes, obviously, when we look around market data, we think of digital penetration and geographic distribution and who are the targets we are looking at. But I think that the real good process is how we question that data, how we collect new data, and how we use and make transparent that data for others to base the models in another solution that can partner with you and base their models on real world data.
Great. Thank you. Thank you, Uche.
I guess it's my turn now. I think just following up on what Vivian and Camila have said, yes, exactly the same issues with market data. In sub-Saharan Africa, it's very fragmented. You have bits here or there, and then you can't exactly pull it together. You are not sure, like, where's it coming from, what's it about. And even within countries itself, you have like various behavioral differences. So you can't exactly make it like a blanket data or whatever over the country. So I think this is one of the things that we are actually trying to pull together from Zero Health, getting our data from Kenya and Nigeria and all different countries. We are now trying to make sure that we get quality data. We try to make sure it's available, because another thing is, even though we have the data, is it clean? Is it good? Can we use it? Can somebody from the UK or the US actually say, okay, we can use this as an example or to represent what's going on in Africa? So as we are right now, market data is sparse, is fragmented, but I think we are getting there. We are pulling together and trying to make sure that with our efforts and with what we're doing right now, in the next couple of years, I don't put a year to it, but at least we can be sure that whatever data that we pick up from the market for Africa and Colombia, right? Argentina, it's clean and good. Thank you.
Thank you. Just like I'm going to anchor everybody again in what these three leaders are doing. So, Nigeria, massive market with huge differentials in income and data access. Argentina and Mexico, and I know you're looking at other Central American countries right now, and you're in 5 or 6 countries right now. 5? Six countries in Africa. So the diversity and the spread and communicating that to investors is just a really tall order. So I'm going to move the market data question over to our thought leaders. Market data is vital for assessing, for assessing the feasibility, scalability, and sustainability of global health solutions. Can you share some examples of how market data has been used effectively to enhance stakeholder engagement and investment in different sectors or regions? And Carolina, I'll start with you.
Okay. Yeah, so I think, after the three founders and representatives of the companies have shared, I think it's very telling that they're looking into those data gaps, but also what the communities and the contexts and the societies are asking for, right? And I think when we think about the market data, I see it as a means to understanding the social behavioral determinants of health and how the populations in this context are demanding health solutions. And we know that there is much more awareness now about health. I think COVID, if there was one of the, positive outcomes, is that people are much more aware of health and prevention, et cetera. And we see that translated into more demand for health, demand for preventive tools, et cetera. So I think that looking into market contextualization, I think that's a big core of what we do at Baraka, and we'll dive a little deeper into that when we talk about our analytics tool. We really try to combine different sources of data. Data from, health-specific data on health outcomes, health determinants. We look into, for example, BMI, body mass index, and seeing okay, what's the trend in terms of, obesity and high body mass index, or I don't know, high glucose monitoring, et cetera, but also understanding what are the development indicators that this local context presents that could be addressed by the companies that we work with. And I think that's a vital aspect of our work, is really to present that and to translate all of that into a narrative that makes sense to investors. And I think, we were in a session earlier today at the World Health Summit that they were saying that, there's so much demand for health, but very little, less than 3% of all assets under management go into health investments. Why? It should be the opposite. Everyone should be jumping into investing in health, right? Because there is a lot of demand, there is a lot of need, but at the same time, I think there is risk aversion, there is a lot of misunderstanding about the markets, and I think understanding this context and really making sure that we're presenting that as an opportunity for investment that will yield a lot of impact for the populations is key. So that's what we're trying to do with the tool.
I think that just really reinforces why we're so excited about the tool that you're bringing to us today. So it's really important. I'm going to take a step back to kind of lean into some behavior science here. we all exist, we don't exist in a vacuum, right? We sit within a context. And just building on your points there, this idea that moving me or anybody in this room along that access continuum from seeking to reaching and actually utilizing care, yes, it can be influenced by my motivations or my capability and my skills, but a lot of it is influenced by the opportunity that I'm afforded or that we are afforded. And that opportunity is influenced by so many other factors. And knowing that is so integral to the market data. As part of J&J Impact Ventures, we spend a lot of time in due diligence, which inherently requires market data. But at the moment, that is having to come from many different creative sources because we sit in the Impact Ventures space. You can't apply a generalized customer acquisition cost in digital health, that blanket percentage, to an impact venture or something that is really, as I said, straddling that line between purpose and profitability. So I think it's really exciting that we're moving toward being able to fulfill that data gap. But I will also say something that is so important is to invest in proximate leaders. I think everything you just spoke about there is the reason why and the reason for that, and is something that is very strongly advocated for and recognized within the due diligence, but also the opportunities that we choose to move forward with as well. So.
Excellent. Thank you.
So thank you so much. So I think there are some very important things also to take into context, and I really like this approach on profitability and impact. And you can't reinvest if you don't make your things run around, and we also need to take that into account. But it's also about that we probably need to realize that we are in a different world. Our healthcare thinking was made for a world for 100 or 50 years ago. We have different challenges today. We have challenges that require that we think hyper-specialized and holistic at the same time. So these are two different ways of using data and applying data. We don't have training for that. There is not a single university course on this. And this is probably what we need to teach our leaders for by using data. So a part of this is also, I mentioned before, some of the indices we have worked with. So we have just launched a severe asthma index. So this is 2% of people with asthma, but 50% of the disease burden on the health system, because there is actually no knowledge. So this is where we are trying to build knowledge across, build best practices or good practices. But it's also about moving decisions from emotions to facts. And I said that in Argentina once, and then told me emotions we need to have. So don't say that. So this is really about also, do we have the guts to do the decision making on facts? You actually need to make that move and do that. And we have tried to move this in different ways. So one thing is the severe asthma, and we are going into the respiratory area in general, which is very underserved, especially in the middle and low-income countries, and where climate change is making a huge impact right now. So that is important. But I also think it's very important to really go forward and say, what is it we want with the data? So that is providing better health to the persons. So the purpose-driven, with which I think this organization is doing, is really important in that part.
Operations. How are you thinking strategically about these data assets as your business grows? It's a really good one to turn to you, Camilla, so I'll let you start.
Great. I think that's a good question. As I think I previously said, data as itself is not an asset anymore. It's actually the way and for what we use it. In the way we are thinking our strategy and value proposition for the market is actually we design a digital platform that's completely data structured. We use AI and we use human value to validate each of our touch points with patients and the data we can collect and for what we can use that data. And the way we see as a value proposition for the market on the use of data is, as I said, on the development of AI. Thinking of how a patient can maybe get, depending on their results on a diagnosis for breast cancer, can give them the best treatment, the more accurate treatment for their biomarkers, where and how, if they can afford or not, and where to go. If they have a clinical trial on their nearby or something, is something that we think we can provide. We are already validating, and it's the way we want to use data for decision making.
Very cool. Either way, Uche, Uche, go.
All right, thank you so much. So I think I will speak on 3 main points. I think first of all, using data as a business asset. First of all, is in our products, in developing healthcare products that are going to, like we said, what we do in Zero Health, making sure that it's affordable and accessible to everybody. So it influences what kind of products we're going to be building and delivering to the community. Also, data is very, very, very key. I think Carolina said something about data is fuel. Fuel. So data for partnerships, for example, it influences who the kind of people we're partnering with, the public or private sectors. And also the third thing is health financing. How do we actually use the data that we have to broker to actually ensure that there's enough financing for health in the different subsectors and in sub-Saharan Africa. So I think these are my 3 points. Make it a bit short and then very concise. Yeah. All right, thank you.
Excellent.
Yeah, so I knew from the very beginning of when we started MedZaf that we needed to kind of help, build that framework so that we could support the aggregation of data, and that could help, kind of guide our path forward. And I'm really happy that we were able to get as far as we did get with building out tools to support not only ourselves, but also support our partners to operate their business in a way where it's not something that you have to think about, that it's just a constant extraction of crucial information that once aggregated could be really useful to not only the company, but also other organizations. And so our future, what we are launching currently and working on is, how can we use some of the tools that we've built for ourselves to support working better with global health, other larger institutions, other organizations that can also support, the main goal of what we're trying to do at MedZaf. I think that, I spent a lot of time, we spent a lot of time in a silo trying to do everything by ourselves. And I think that the future is now like, how do we all hold hands, kumbaya, and like work together to tackle these really hard problems, because a startup cannot do it on our own. And so that's our future, is more of like, how can we make it easier for all of you all to be able to plug in to what we're doing and create partnerships that are really sticky, because that information is transparent and available.
We all know it. It's about partnerships, about collaboration. I know everybody in this room knows it. Now I want you all to go out and live it. I mean, what does it actually mean to do it? Because it's critical. Okay, quickly turning over to our thought leaders. Data is a key driver of innovation and transformation in the health sector. What is your vision for the next 3 to 5 years of data-enabled health solutions in emerging markets? You can be quick and short, and I'll start with Kara. I'm going to end with you, Boy. Yeah.
Yeah, very briefly, I think, I think when we think about data, maybe in the 3 to 5 years time frame, I hope that data is seen not as an end in itself, but a means to improving health, right? And I'm saying health, not healthcare, because I really hope we move from healthcare to health and well-being. And I think, good data, and not all data is born equal, right? So we have good data, we have bad data. So how can we together collaborate between the different players, private, public, NGO, civil society, to collect and to work on the good data, so that will inform good solutions. So that's my vision for the short term and mid-term and long term.
I think if I were to say from a very naive, dream-based vision, I would love to see us embracing data, being creative with it, unlocking opportunities in the same way they have in the entertainment industry. I cannot fathom how Netflix knows me better than I know myself. How can we translate some of that investment, support, creativity into the healthcare space, which one could argue is much more important. And then I think ultimately, yes, technology can help us get there, not necessarily emerging tech, exciting, shiny, but basic tech, and using existing technology, but in new ways. I think new models are needed, new models for evaluation, and RCT doesn't necessarily have to be the gold standard. New models for investment that acknowledge longer returns. You know, it takes a long time to prove health outcomes. And I think new models, to quote Ian Walker earlier, that really position health workers as an investment and not a cost. And then finally, people, the people in this room. You really are on the front lines, and being able to hold that kind of paradoxical thinking of not reinventing the wheel, but also reimagining healthcare, that is incredible and something we really need to foster. And, you know, of course, then having funders in the room who are going to support you in that mission.
Thank you. Boy.
Thank you. I'll talk really fast. So just imagine if health is the most important societal pillar. That's where we start. That's what builds value. So that's what we need to seek for. I also dream about that the emerging and low economies are not gonna play catch up, but actually do a lot of leapfrogging. I do think that the legacy challenges we see in this part of the world does almost make it impossible to do what is needed. So I do expect that that is possible. It does require that we get a totally different view on private-public partnership and playing field. Probably we need to merge it with responsibility both ways. We probably need to reinvent the data intent concept. So actually the enforceable use of data that has a public good value, both for public and private. We need the data solidarity and data governance that actually works. So not just protect data, but actually use data to protect people and help people to get healthy. So we did in 2019 end up with a concept called 5-5 in the Nordics. So it's based on that the Nordics use 10% of the GDP on health or sick care. So the conclusion was that this is not sustainable. So what happens if half of that goes toward prevention, primary, secondary, and tertiary prevention by 2030? We might not reach the half, but just reaching 10% of the half is actually a huge achievement. So this is how I dream that we can push these things forward. And the last thing I just will mention here is we are right now working in Mexico City, just trying with modern tools to assemble the data that they have scattered around in Excel sheets and other stuffs because they don't have had the means to do so. And small steps where we have technology can make a huge impact. And I dream that we can scale those things.
Excellent. That's a nice place to start. You've all been in a lot of conferences and a lot of meetings. Keep your energy there. We're going to show you something really cool. I'm going to turn this over to Carolina. I'll ask all of our panelists. Thank you very, very, very much for your time and your wisdom. We're ready to show them Baraka Analytics.
So thank you for the panelists. We're very grateful for what you shared with us. And now, maybe the next slide, we're going to be now sharing with you what we're here to do tonight, on top of like learning from everyone who just shared their expertise. We're talking about the Baraka Analytics. So we're very excited to unveil this tool that we've put so much work and passion. And again, once again, thank you so much for the generosity and for the trust from Johnson & Johnson Impact Ventures to help us make this reality. So basically, everything that we just spoke about, what if there is a tool that can bring different data sources together, different types of data from internet penetration to the specific health data or development data, road access, et cetera. What if there is a tool that brings all of that together, that uses all of this data combined from different sources? And we're working with the IHME, we have a partnership with them, UNDP, Sustainable Finance Hub, the World Bank, and other sources. So what if we get all of this data, we bring them together, we make them easy and understandable for a known global health person to make wise investment decisions? And that's what Baraka Analytics is all about, is bringing that and in making sure that we make this data visible and accessible for investors that can access the companies, but also understand, where their dollars will go to. What's the impact of their dollars in investing in those companies? How the investments will impact the health of that population, the well-being of that population. And then, of course, this is also a means to bring together investors, but also co-investors together, because a lot of times what we see is that there is an investor here that says, oh, I'm interested in doing this, but I'm not going to invest alone. I need a co-investment. So really one of these tools, the objectives of this tool is really to make sure that investors can communicate, of course, with all the respect to, whatever they need in terms of, the confidentiality, et cetera, but really bringing them together and making that a platform that they can discuss and even start some analysis and analytics of this company. So without further ado, I will show you a video that was put together by our amazing co-founder, Audrey Selian, and she will walk us through the Baraka Analytics, and I hope you enjoy it. We're very excited about it, so please.
Welcome to Baraka Analytics, the pilot product platform of Baraka Impact. Baraka Impact Finance is poised to transform financing in public health. We focus on the innovation bubbling up from the vast pools of talent in emerging markets. Our objective is to make visible and accessible profiles and stories of innovators whose solutions are transforming health access, affordability, quality, and equity for the billions of the underserved on our planet. Baraka Analytics offers robust commercial and social impact profiles of groundbreaking companies and people providing innovative solutions across the health services continuum. The Baraka Impact Finance team brings a unique combination of medical expertise, public health intelligence, and emerging market investment experience to its analyses of these companies and frames their insights with a data analytics layer using economic, health system, demographic, and other market context to offer investors clarity on where impact is greatest and where scale and sustainability are achievable. All investors receive personalized login credentials to access their tailored dashboard. At the top of the investor dashboard, investors can browse through recently added pitch videos or navigate directly to the Discover Opportunity tab to explore open, available opportunities listed on Baraka Analytics. These are vetted and selected by Baraka. On an investor profile, investors can build out a rich, robust profile showcasing themselves and what they do with as much or as little detail as feels comfortable. In the Discovery tab, Baraka Analytics allows investors to apply various filters in order to align selections with their own investment criteria. Alternatively, they can click on a detailed map for a more concise list. After applying filters and generating a short list, a quick hover over a company name provides details about a current ask. Clicking on a company grants open access to a full profile exclusively available to participating investors in the Baraka Analytics pilot. The Enterprise tab offers a unique and informative snapshot of critical information. View a brief video showcasing the company's journey and its core product or service, and explore the company's impact mission and alignment with SDG targets. On the Opportunity tab, one can dive deeper into details about an ongoing raise, key financials and use of funds information, and see who else is at the table for potential co-investment. You'll notice the Diligence tab here, which is where the output of an investment appraisal process sits. Baraka conducts this diligence with 50 questions emphasizing and evaluating commercial scalability and the key measurable social impact KPIs to be monitored. Diligence typically comprises 6 sections, including business opportunity, target market and health system context, social impact, innovation and scientific vetting, management team, and financial management. Investors can use this Q&A section to seek clarifications or request additional information from the founders. Finally, a brief look at Baraka's Unique Intelligence tab. Here, we utilize data analytics to access health indicator figures relevant to the company and its operational region. We understand the company's role in improving the healthcare landscape through 4 essential lenses, including health determinants, health outcomes, health financing, and infrastructure. And here we may also stay informed about changing dynamics in policy, financial incentives, and regulation in the region, drawing from key data sources such as IHME, World Bank, and the UNDP SDG Finance Hub. Moving back to the dashboard, from the enterprise profile, investors can easily return to their dashboard where they can connect with fellow investors and explore other opportunities. Baraka Analytics has been funded by Johnson & Johnson Foundation, and active outreach is underway to secure participating investors in a pilot that launches in mid-October 2023. Baraka's team is actively looking for strategic funders and partners between now and Q1 2024 in order to take Baraka Analytics to scale. If you're as excited about what you see as we are, please contact us to learn more.
Yeah, we're really excited. It was a lot of work, and it still is a lot of work, but it feels like it's moving things forward, and we've had really, really great responses, both from the founders as well as from investors who've had a chance to look at it. So we do have most of our investors already chosen. If there are other investors or funders, and I say that very broadly because we're interested in working with foundations, grant-giving foundations, as well as those who are involved in debt and equity investment. We've got really until October 31st to identify any remaining investors for the pilot purposes. We've already uploaded the 50-plus companies. You've seen just one profile today, but Zuri Health is also beautifully displayed on this platform, and we hope that MedSaf will join us as well very soon. The only commitment that we're looking for from funders who join is to give us feedback. We need user feedback. We need to know how this is working, and we need to know how to take it to the next step. Next slide, please. So the call to action from tonight's meeting is if you are an investor or funder, or you know others who are out there and who would like to join us, we would love to hear from you as early as October 31st. As I said, we've identified most, and most have already said yes, but we would love to make sure that we've got a great and diverse selection. New companies, we get approached regularly, and we can have a whole set of conversations about how many companies are out there. There are a lot. And we are getting approached weekly by many qualified companies. So we're a small team. We have to watch our bandwidth in all of this, but we never want to say no. So we have ongoing screenings of companies and onboarding as the year goes forward. Also, next slide, please. We're thrilled, really, really excited to know that our future includes the Copenhagen Institute for Future Studies. We're delighted with the partnership that we're forming right now, and they've agreed to help take us to the next level so that we're not just providing data indicators, but we're providing future-proofing strategies, planning beyond forecasting, risk analysis, and foresight-driven investment processes. We've been listening to investors. This is what they're asking for. They want to de-risk their assessments. They want to mobilize more capital, and we believe we've got the ingredients to do that, thankfully, with the Institute's relationship. So very, very, very nice to announce this. Yeah, more to come on all of that. Brief few moments. I know, like, again, I feel all of us have been sitting in meetings for the last few days, so I don't want to drag you through any longer, and there's food sitting out there. But if there are any questions, we're very happy to answer those right now. Would love to hear from you, and we can also just mingle and talk to one another one-on-one. Rebecca will be here with a laptop in hand. If anyone would like to see a bit more, she can navigate. They told me not to live navigate while you are all watching and while we're live streaming, so we didn't do that. But Rebecca can take you through multiple profiles and show you the way the tool works if you want to spend a couple minutes with her as well. Questions, comments? Yeah.
So I'm Sharbani Chakraborty from Technical University of Munich. And so Jin has always mentioned that they've had real difficulties doing anything around data in the health sector. So they have it for SMEs. They have it even for, I think, for agriculture, but they don't have anything. So I was wondering, is there any partnership there? Because that's a wider network. Thank you.
There's not a partnership in place, although we could certainly have that conversation. They do have health sector metrics, the IRIS Plus for health, and we've been challenged to bring those in so far. So we use accessibility, affordability, quality, and equity as the primary lenses. Then we identify KPI that speak up to each of those lenses, and then we develop the social impact narrative around that. That's our general methodology for assessing impact. That hasn't completely jived with the IRIS Plus metrics, so we're proceeding forward. This is a work in progress, like a global work in progress. And so I met with Amit Buri, the head of GIN, just 2 weeks ago, and he's super enthusiastic to talk to us more, and so a collaboration there would be a great thing. Yeah. Other questions? I really appreciate your patience and your being here. It's been delightful, and we can talk some more. And please eat food and drink. Thank you.